What's up, guys? I'm back. This is the Bad Back Guy. This is a video on medication, and I have tried a lot of different medications, and if you dealt with back pain yourself, you've probably tried a bunch, and the interesting thing is for me is that I've noticed is that after trying a lot of them, that the thing that works best for me now is Advil, ibuprofen, Aleve, Tylenol, and I've tried a lot of different medications. I tried medications that are normally used for antidepressants, or they're used as antidepressants, and basically been shown to have some pain relieving effect. I think to kind of help numb the pain, or make it, I guess, a little more tolerable. I don't think any of them are meant to completely take you from a 10 or an 8 to a 0, but they might knock a couple points off the pain, and I'm talking about things like these are older antidepressants like nortriptyline, amitriptyline, and some of the newer ones, one called Cymbalta. Some people use that, and with those two or three, I never really got much relief. To be honest, I got more side effects, and with the Cymbalta, I couldn't really take it because I took it for one day and I had a pretty bad reaction to it, and just one of those medications that didn't really sit well, and there's another bunch of medications that I tried. They're really anti-seizure, or sort of for epileptic patients as well, is the main use, but stuff like Topamax or something called Keppra, which was the one I used most recently, and these were for mainly the radiating pain, the pain in my legs and my arms, and I didn't really have too much success with them. I think their use is kind of definitely hit or miss, or depends on the person. I would definitely, if you're in pain management, or if you have back issues that are chronic, or just pain issues that are chronic, and if you're seeing a pain management person or your doctor, they're definitely worth trying. I guess I can't go in this video without mentioning the most popular one, or seems to be like the most popular, was or is something called Lyrica. I'm sure if you've turned on a TV, you've seen their commercials, and it's the newer version of something called Neurontin, and those are also supposed to help deal with the pain in terms of, I would just say the only thing I can think of is like to dull it, to numb it somewhat. I think from what I understand, the whole idea is just to basically interfere with the amount of pain, and the sensitivity of your nerves, so that you don't feel as much or notice as much. And honestly, those did not really work for me. Neurontin didn't work. That's like the first one you might try, and then Lyrica is sort of the newer version of it. And that one I had a fainting episode on, so I just definitely didn't feel right on that one. And I didn't really continue that one or actually, no, that's not true. Sorry. It's been a while since, that was about 10 years ago that I tried that medication. I did take that medication, even though it's having bad side effects. And I went up to, sorry, I can't remember the exact doses now, but you start out low and then go higher. And I didn't really see much benefit. I had this kind of strange effect where I already have numbness in my feet from the pain, but it kind of made that worse. Or it's like, when your foot falls asleep, it's not that foot fall asleep feeling, but when you're stepping on something and you don't really feel it. So when I would walk, I would have kind of a I couldn't really sense my foot touching the ground. I mean, I could, but it was lessened, and it always kind of felt like I might fall over, or there was dizziness. That was my other main issue with that. But what I want to say is that I think if you're dealing with any type of back pain, or really any pain in general that's chronic, but this is the Bad Back Guy channel, right? So I'm going to relate it to my issues with bad back. And again, when I say back, it also means leg pain that you might get that radiates from your back, or it might be your mid back, or neck pain that radiates into your arms, or into your hands. I think if you're new to it, obviously talk to your doctor, your doctors. But if it's at the point where it's a chronic thing, I definitely think seeing a pain management doctor is worth it. It may sound obvious, or it may sound maybe like it's too much of a step, but basically these doctors are more used to dealing with these issues. So if you go to your primary care, they might have heard of Lyrica, or they might have heard of certain medications, and most of the time they're probably just going to give you something like that, or they'll give you the standard ibuprofen, anti-inflammatory. But if you want someone who's really basically experienced in these different medications, then you want to see, basically, from what I understand, it's either a pain management doctor or someone called a physiatrist. That's, I know, an interesting kind of weird word. Not a physician, but a physiatrist. If you're lucky to find one in your area. They're more common now, but seems like, from what I can tell, they're kind of interchangeable. But if there's a pain management clinic or pain management doctor that you can go see and try out some of these medications, because I've talked to some people who have a really good response to the antidepressant medications. And when I say antidepressant, doesn't mean you're depressed. But that's the main use, and honestly, many of them are older antidepressants, so they are not even really used as much for depression, but they've just been shown to help with pain. So you can ask your doctor about some of these medications, or your pain management specialist about some of these medications, because, like I said, they can have pretty good effect, and I know even in some cases, some people just take a low dose of one of whatever medication they and their doctor decides to start, and it makes their pain way more manageable, or it takes them from a 5 or 6 down to a 1. And if you're having that chronic burning pain in your arm or your leg, your thigh, your foot, and it's kind of like that annoying nagging pain, it could help to eliminate that or make that much more tolerable. Or if you're having that really bad pain, then it could help bring you from like a 7 or an 8 down to like a 4 or 5, like on the pain scale. So yeah, that was just the main point of this, is to go beyond. I mean, if it's working out with your primary care doctor and it's helping, then you're fine. But I think there's definitely a point at which a pain expert or pain management expert is worth talking to, and also be open to these different medications, because they could definitely help out. I'll say for myself, the latest medication, or the one I've been taking for the last couple of years, is it's called Keppra. That's like the brand name of it. If you Google it, you'll find it. But that seemed to be the one that like helped for me, and just taking off some of the pain, and the odd thing, after all these like procedures and all these treatments and surgeries and trying all these medications, the things that I go to now are things that you can walk into any CVS, Rite Aid, drugstore, grocery store. I use ibuprofen. Like that for me is what works. And I know you can also go to your doctor and there's prescription, anti-inflammatories, and you can, get stronger ones, and sure, you can try those too. But it's just kind of ironic that the thing that I've used that works the best is something which is good, that I can walk into any store and get it, but you would think it would be one of these like fancy new drugs, or you see commercials for all these new drugs, or I've seen so many doctors, and like good old ibuprofen, Advil, still is what is typically my go-to. But you have to be careful with those drugs. You've probably heard any drugs, and none of this is medical advice, of course. Talk to your doctor. But definitely with the anti-inflammatories, you want to be careful when taking them, because of the gastrointestinal effect it can have. Basically stomach bleeding, ulcers, stomach upset. They're pretty harsh on your stomach and your GI system, so take them with food, and try to take them in the least dose possible is what I do, and as infrequently as possible, and space out the amount of time like between, because the longer you take them, obviously the more the potentially damaging effects there could be. So the last one I'll mention is when I have like really bad flare-ups, or the last two, but is you can take, which is probably something you're familiar with, is prednisone, which is basically an oral steroid. When I have bad flare-ups, I get these, if I do something I'm not supposed to, or just out of the blue, really, I'll get horrible back pain, like pain that keeps me in bed, that I could hardly even move, or just, getting to the toilet is an accomplishment, like getting to the bathroom. But I'll use oral prednisone, and I usually do like 40 milligrams for 5 days. And you might have seen they also have these steroid packs. They come in where you take them in a certain like number each day, a certain dosage, and you taper up, taper down, whatever. but that one's sort of the big, like, in terms of oral medication that I'll go to when I'm having a really bad flare-up, and I don't want to take ibuprofen like a mass amount for like a week or two to try to get over the flare-up. And of course, the last one is I will take Percocet sometimes. To be honest, in my experience, it's been pretty hard to get. Sorry about that. With everything that's been going on, that's like a whole separate topic. But when I'm in like really bad, excruciating pain, I'll take those. And I try not to take those often, or actually I really don't. But sometimes they are painkillers, and sometimes you need them if you're in a lot of pain. So, yeah, I mean, I hope I know that was a lot that I just threw out there, but I was just trying to cover as much as I could, and I'm sure there's a lot I left out, but yeah, I hope that helps, and let me know what works for you, what you've had success with, what you haven't had success with, what you've had bad side effects with, what you've had low side effects with, or no side effects. And I know it depends on the person, so there's definitely no one drug that works for everyone. So yeah, I'd love to hear what everyone out there's experience is, and like I said, I'm always willing to look into other avenues, other medications. Anyway, I hope this was helpful, and I'll see you guys next time. Thanks a lot. Bye.